So Renisha, are you telling me that both the cure and the prevention to having any of these conditions is abstinence? No, not exactly. Hello and welcome back to my channel. In this video, I want to go over the top 3 reasons that women seek medical care. Now, with these 3 common conditions, women, they usually self-medicate or treat using over-the-counter products. Okay, let's jump right into it. Vaginal symptoms are usually related to 3 common conditions: bacteria vaginosis or BV, candida overgrowth or candidiasis, also known as yeast infection, or trichomoniasis, also known as Trig. Now, all of these conditions could be caused by sexual intercourse, but only one of them is actually considered a sexually transmitted infection. Stay tuned to learn which infection, in fact, is an STI. For starters, bacteria is not some disgusting word. It's not something that only people with infections have in their system. In fact, there is a such thing as both good and bad bacteria. The vagina is a self-cleansing organ, and it hosts millions to trillions of good and bad bacteria. When there's an imbalance between the two, it alters the normal pH of the vagina. Now, the vagina has a normal range, pH range between 3.8 and 4.5. That brings me to the most common cause of vaginal infections, which is bacterial vaginosis. Most people refer to it as BV. The most common bacteria that's colonized in the vagina is lactobacilli. And when the pH, the normal pH, begins to climb and it rises above that 4.5 threshold, that's when the bad bacteria begins to take over. So again, when you don't have enough of this lactobacilli, the bad bacteria begins to take over. If you've had BV before, or you suffer from recurrent BV, then you pretty much know what to look for in the signs and symptoms of BV. It's those women who've never experienced BV before that really should seek medical attention. Reason being, even if you think you have BV, you could also have a sexually transmitted infection. It's very common for women to have BV along with an STI. Also, BV, it places you at a higher risk for contracting other sexually transmitted infections, including HIV. The most common symptom of BV is fishy odor. 50% of women, they won't have symptoms, but for most women, that will be the first symptom, is the fishy smell. And there's no better descriptor, no better way to describe what the odor smells like. It smells like fish, fresh fish. This can be quite bothersome for women who aren't familiar with the causes of BV and what's causing that fishy odor. It's common for women when they go into the doctor to have what we call a whiff test. I've done many of these tests with women to test for BV or other infections. What we do is we take some of your vaginal fluid, some of your vaginal discharge, and we smear it on this microscope slide, the little glass slides that go under the microscope. And after we look at the slide, we do what's called a whiff test. So we take a solution and you pour it onto, or a couple of drops onto the vaginal fluid, and you whiff. You actually go like this to smell if there's an odor coming from that fluid. But let me tell you a secret. It's not really a secret. When most women have BV, You don't need a whiff test. A lot of times the women, they'll smell themselves before, going into the doctor. They usually know what's wrong. Like I said, it's a strong fishy odor. Sometimes the patient will come into the room and the smell will hit you before you even introduce yourself to the patient. And it's why they come to the clinic for treatment. BV is one of the most common causes that women seek care for. Now that we've addressed the elephant in the room, it is important or reassuring to know that BV is not caused by a sexually transmitted infection. In fact, you may be abstinent or have never had sex and still could get BV. Other ways for your practitioner to confirm the BV diagnosis is when they're looking under the microscope on that same slide that they did the whip test, they're able to see what's called clue cells. Now, clue cells are normal vaginal cells, and we call them clue cells because when you look under the microscope, the borders are hard to define. There's so much bacteria on that cell, it's hard to see the borders. In other ways, the practitioner will be able to diagnose BV. For one, your pH will be above 4.5. You may have that milky and odorous discharge. So, number 2. The second most common reason women seek medical attention is for candida overgrowth or yeast infection. Yeast infections are mostly caused by an overgrowth of a fungus called Candida albicans. Like I explained earlier, balancing both the good and the bad bacteria can be tricky. Candidiasis is extremely common. Over 75% of women will experience a yeast infection at least once in their lifetime. So that's every 3 out of 4 women will have a yeast infection at some point throughout their life. Now, the most common symptom of yeast infection is a cottage cheese-like discharge. And I'm sorry to continue to use food, fish, and cottage cheese as examples, but it actually gives you a great depiction of what candida actually looks like. For anyone who doesn't know what cottage cheese is, Google it real quick, look at the Google images, and you'll see. It is what it is. That's the best way I can describe what a yeast infection looks like. Another common symptom is itching. Women will complain of itching or redness and irritation in the vaginal area. The vaginal pH is usually normal. The pH is not usually affected with the candida overgrowth, whereas we discussed the pH being higher when you have bacterial vaginosis. And when the practitioner looks under the microscope, they're going to see cells that resemble spores, hyphae, or yeast buds. Now, a yeast culture is another way to diagnose yeast infection, but usually off of the symptoms alone, the discharge, the itching, it's enough information for the practitioner to diagnose and treat you the same day. And lastly, I mentioned in the beginning of the video that one of the 3 common conditions that women seek medical attention, one of them was a sexually transmitted infection. And that 3rd condition is trichomoniasis, or Trig for short. Trig is the most commonly sexually transmitted infection, and over 5 million women each year are infected. Trig is caused by a parasite called Trichomonas vaginalis. Now, Trig is easily sexually transmitted. In fact, it raises your risk of contracting other STIs. Now, what's scary is Trig is commonly asymptomatic. Many women won't know they have the infection. So that's why I strongly encourage women to seek medical care when they're having any type of symptoms or discharge that's not considered normal. And it's important that you familiarize yourself with what is normal. so that you know when something is wrong and when to schedule an appointment with your primary care provider. Other symptoms of Trig may include a yellow to greenish, frothy or bubbly type of discharge. You may also have some itching and irritation in the vagina area as well. I purposely didn't list the causes for each condition separately, and reason being is a lot of these conditions overlap. In fact, when you're treating one condition, it's very likely to cause another. For example, if I'm treating bacterial vaginosis with an antibiotic, I'm washing out all the good bacteria, right? In fact, antibiotics, they're not really specific. They kill both good and bad bacteria. So if I'm getting rid of the good, like we discussed earlier, it places you at higher risk for yeast infection. So something that many women don't realize, all of these conditions can be caused by having sexual intercourse. We talked about the vagina being a self-cleansing organ and the importance of maintaining both the good and bad bacteria. Having intercourse, it alters this balance. So Renisha, are you telling me that both the cure and the prevention to having any of these conditions is abstinence? No, not exactly. There are many ways to remedy a yeast infection or the candida overgrowth. There's over-the-counter products, there's prescription medications, and also natural remedies. I won't go into too much depth on each of the medications, but I will share what I feel are some true and tried methods for both preventing and treating candida overgrowth. Okay, ladies, we like to smell good. We like to look good, especially for our significant others. We go out and we buy these cute, fancy Victoria's Secret underwear, thongs, lace. We're wearing these spandex and tights and form-fitting jeans. All of these things are contributing to your yeast infection. The vagina likes to be in environments that are dry, well oxygenated. She likes to breathe. She's not able to do that when we're wearing these really tight and non-cotton materials. When we wear these kind of materials and we're wearing very form-fitting undergarments, what we're doing is we're creating an environment where bad bacteria loves to live. And again, the normal pH of the vagina is altered. I know you didn't send for me, but ladies, when we know better, we do better. Other things that are going to throw off the normal pH are going to be scents, perfumes, and dyes. That includes your Bath and Body Works, your Victoria's Secret, all those good smelling body washes that aren't meant to cleanse the vagina. The vagina is a self-cleansing organ. You don't need it. In fact, little TMI, I don't use soap down there. If you're going to use any soaps, I would recommend those that are pH balanced, that are specifically targeted for that area. Soaps that don't include perfume, dyes, they're usually listed as sensitive or soaps for sensitive skin. Maybe even trying some baby products. The vagina is not supposed to smell like flowers, okay? It's not. A very common treatment for yeast infections are antifungals. For example, clotrimazole. So I have a box here of clotrimazole. This one is a 7-day use. Now it comes with the tube of cream, the antifungal cream, and an applicator. The thing about this one, it's a 7-day treatment. And honestly, I don't really care for the vaginal creams like Monistat. I just haven't had much success with them. Now, there's some women that swear by the cream and they have good results using a vaginal cream. I just honestly don't feel that they are very effective for me. What I also don't like about the cream, is that, especially with that one, it's a 7-day use. In fact, I would prefer to call it a 7-night cream because it's messy. You want to use this at night while you're asleep. So that would be the reasons why I don't really care for the cream. Now, treating bacterial vaginosis, it can be tricky because, like I said earlier, when you're treating one condition, it may cause another. The most common treatment for BV is the use of an antibiotic. The most common antibiotics used for BV is metronidazole and clindamycin. And what happens when you use an antibiotic? It wipes out the good bacteria, which may cause a yeast infection. Some women are stuck in this constant battle of treating both BV and yeast infection, treating one, then having to treat the other. And it can be quite bothersome for most women. Okay, ladies, listen up. Can you hear me? Come a little closer. No, I'm kidding. But, oh my goodness, why am I 33 years old and just finding out about boric acid? Boric acid has been used for over 100 years to treat both BV and candida overgrowth. Why is it that my OBGYN, my main gynecologist, my women's health provider, no one has ever mentioned to me boric acid? I feel like they've done me a disservice by never recommending boric acid as a treatment option. This right here, game changer, life changer, let me say that. Can you see it? I use the PhD Feminine Health, and I get this from Target. You can get it from Walgreens, Walmart. Let me read it for you. Promotes normal vaginal health. Doctor recommended for vaginal odor. Effective in preventing odor caused by menstruation, intercourse, exercise, vaginal imbalance during menopause. Really, what this is telling me is these are helpful in maintaining the normal pH of the vagina and preventing vaginal odor. But what it doesn't say on here is how well it works for treating BV and yeast infections. Now, with these suppositories, it says insert one into the vagina as needed before bedtime every 12 hours. What I like to do is what I consider a loading dose. I take 2 of these, 2 tabs, and at night I insert them in the vagina. It is also messy, so you want to insert this when you're going to bed. Maybe wear some cotton underwear and you don't need to, but maybe a panty liner because it is a little messy. So what I do is I insert to the night I'm having any symptoms, any odors, any itching. If I'm having any type of vaginal symptoms, I'll use that. And I start with the 2 doses. For me, it just feels like it works better when I start off aggressive. And from there, each additional night, I use 1 suppository until the symptoms are gone or until I feel comfortable stopping the treatment. And another thing that I do is I take a daily probiotic. And this is the Garden of Life probiotic. This has 33 probiotic strains, and not only that, it has other supplements and vitamins such as vitamin C, vitamin D, vitamin E, B1, B2, B12, folate, which all women in their reproductive years should be taking. And this probiotic blend has a ton of lactobacillus. I told you that was the good bacteria that makes up most of the vaginal flora. So yes, this one is an oral capsule. It says to take 3 each day. I only take 1. I hate swallowing pills, so For me to take just one of those a day is enough. But like I said, it has other vitamins and supplements in here, which I think is awesome. You can find these on Amazon as well. I would be interested to know if you have used a boric acid suppository before. If you feel comfortable, write down in the comments on what brand you use and what you use it for. I think it will help so many women to see how beneficial boric acid is in fighting candida and BV. I appreciate you all for sticking with me through this lengthy video. I want to quickly talk about the treatment for Trichomonas or Trig. Now, Trig can't be treated over the counter. And as I explained, it is a sexually transmitted infection. You would definitely want to see your primary care practitioner for treatment. Again, many women may misdiagnose themselves, may think that they have one type of infection when it may be another. And it's really important, if you aren't familiar with your body, what's normal and what's abnormal, I recommend that you make an appointment with a provider and make sure you don't have any of these conditions, and to test for other STIs. Because I'm only giving you the top 3 conditions. There are other STIs, and unfortunately there are some infections or diseases that you can't treat. With that being said, if you are engaging in what I consider risky sexual practices, maybe you have more than one partner, maybe a new partner, having unprotected sex with someone who don't know their status, have never been tested for different STIs, I would recommend to make an appointment with your provider and get tested. It's important that everyone know their status, whether they are currently sexually active or not. And for women who, like I said, they know their body, they know what's normal and what's abnormal, they'll know if they're having BV symptoms or yeast infection based off the different symptoms that I went over earlier. Most women, they'll self-treat, but if you are in a new relationship or having sex with a new partner, I would recommend, if you're having symptoms, to get tested. So that was the 3 most common reasons women seek medical attention. And I'd like to hear from you all. Write down in the comment section and let me know any tips or tricks that you all use to prevent yeast and BV. Also, if you enjoyed this information, hit the like button. It lets the YouTube algorithm know that you find this information useful and it recommends to other viewers. So until the next one, thank you all for watching, and stop. Shh. My cat. So until the next one, thank you all for watching. Hit the like and subscribe. See you in the next one.